Good day, I'm Pearl Angel Sabal from the SN1B, and today I will be doing the assessment of the head, the neck, and the regional lymphatics. So first I will be assembling the equipments that I will be needing for this procedure. I will need a stethoscope, a cup of water, and a pen light. Now I will introduce myself to my client and I will verify my client's identity. So, good day po sir. I am your nurse po. I'm Pearl Angel Sabal and may I know your name po?
My name is King Christian Sabal po.
May I know your age po sir?
I'm 16 years old.
Okay sir, thank you po. And then after that, I will explain the assessment, procedure, or the process to my client and I will secure consent from my client as well. Okay sir, today po I will be assessing your head, your neck, and your regional lymphatics po. So I will be palpating, inspecting your head, your neck, and the lymph nodes po in your body to determine underlying health problems, and I will also determine your health status and your health condition. So I will be using my hands po during the procedure to touch various areas of your body. Would that be okay with you, sir?
Yes po.
Okay, sir. Thank you. And then instruct the client to explain that you will be touching the client in the various areas or parts of his body with different parts of your hands. So as I said nga po sir, during po the procedure, I will be touching po your body, especially your head, your neck, and your lymph nodes po, using my hands, specifically po my fingers po. So, okay lang po ba sa inyo yun, sir?
Yes po.
So just tell me sir if there is any discomfort you're feeling or you're uncomfortable already, or when you feel any pain po during the procedure. Okay po ba yun, sir?
Yes po.
Okay. Thank you po, sir. And then I will now provide warmth for the patient and make sure that the client is comfortable. Okay, sir, are you comfortable po with your position?
Opo.
Thank you, sir. And then I will provide privacy for the client, so I will close the curtains around the bed or around the area we are doing the assessment or the procedure, or I will also close the doors of the room if possible. And then I will provide a well-lit room for me to have an easy and clear visualization during the assessment. Now, after that, I will perform hand hygiene and observe other infection control procedure. Now, following the nursing assessment, I will proceed to the client's history taking. Okay, sir, do you have any experience po of headache?
Wala po.
How about dizziness or lightheadedness?
Wala naman.
Do you have any experience of spinning sensation or blurred vision?
Wala naman.
How about recent experience of loss of consciousness?
Wala po.
Okay, sir, are there any neck pains you're feeling?
Wala.
Do you have any difficulty moving your head and or your neck?
Wala naman.
Okay, sir, do you have any facial pains po?
Wala.
How about twitching or unusual movements?
Wala.
Okay, sir, do you have any presence of lumps or lesions on your head and or your neck that does not go away or does not heal?
Wala.
Okay, sir, last po, do you have any recent injury to the head or to the neck, like trauma or fall or surgery?
Wala naman.
Okay, sir, thank you po, that's good. Now, after the history taking, I will proceed to the physical assessment of my client. So I will first inspect the head of my patient. So sir, I will be starting na po, okay?
Yes po.
So I will inspect the head of my patient. So I will have my client sit in a comfortable position and I will face the client, and with the head of the client the same level as my head, I will inspect the head for the shape and symmetry. Okay, sir. Harap lang po sa akin. Okay, yung head niyo po. So the client's head's shape is in oval, and the client's head is in midline position, and the size is appropriate in relation to the body size of the patient, and the head is symmetrical or symmetric. Now I will proceed to the palpation of the head. So I will place the fingertips or my fingertips and finger pads on the scalp of my client's head, and I will palpate it all over the surface, beginning to the frontal area. Sir, sabihin nyo lang po pag meron pong masakit sa part hinawakan ko, okay? So, I will begin on the frontal area, and then I will continue over the parietal to the temporal, and into the occipital area. So in palpating the head, we will assess for the contours, for any masses, depressions, and tenderness. So sir, wala po bang masakit? Meron po masakit? Okay po, thank you. So the patient's head, or the skull of the head, has a hard and smooth contour, and there are no masses present. There are also no lesions or any lumps, and there are also no depressions, and there are also no tenderness as reported by the patient. And then also we will palpate the temporal artery, which is located on the anterior of the tragus of the ear. So the temporal artery is palpable, and the pulsation is strong. Now, after palpating the head, we will now proceed to the inspection and palpation of the scalp. So I will part the hair repeatedly all over the scalp, and I will inspect the scalp for presence of lesions and masses. And I will also place my finger pads onto the scalp to palpate the scalp for any lesions and masses as well. So I will start po. So there are no any presence of lesions, lumps, or masses in the scalp, and the scalp is shiny and the scalp is intact as well. After that, I will now inspect the face of my client. So I will observe my client's face for expression and for the shape of the face. It could be round, oval, or slightly squared, and I will also inspect for the symmetry of the following features, which is the eyebrow, the eyes, the mouth, the nose, and the ears. And I will also note for any swelling, abnormal features, and any unusual movements. So sir, I will observe lang po yung face niyo. Can you smile for me, sir? Okay, sir, thank you. So the client's face is in oval shape as well, and the client's face is able to have some expression. And then the eyebrows are symmetric. Can you move them for me, sir? Okay. The eyes are symmetric as well. The nose is symmetrical as well. The mouth and the ears. There are no swelling, abnormal features, and there are also no unusual movement that is observed. After that, I will now auscultate and palpate the mandible. So I will use the fingertips of both my index and my middle finger to locate the temporomandibular joint, which is in the anterior of the tragus of the ears on both sides. I will hold both fingers firmly in place over the joint, and then I will observe for the relative smoothness of movement and whether or not the client notices any discomfort while opening and closing the mouth. So, sir, sabihin niyo lang po sa akin kapag may masakit po kapag in-open and close your mouth. Pone? Po, sir? Sir, open and close po yung mouth. Sa papa. May masakit po ba?
Wala po.
Okay, thank you po. So, there are no tenderness or any discomfort reported by the patient, and the movement of the mouth of the patient is smooth, and there are no abnormal movement observed. Now I will remove my hand and I will place the dial of my stethoscope over the joint, and I will listen for any sound when the client open and closes his mouth. So, sir, open and close the mouth yun po ulit. Okay? Okay, open. Sa po. The other one. Okay. There are no any signs or there are no any sounds abnormal sounds like cracking of the joint observed, so there is a clear sound indeed when the client open and close his mouth. After that, I will now inspect the neck. So with the client's head in a central position, I will inspect the symmetry of the sternocleidomastoid muscle anteriorly and the trapezius posteriorly. So, sir, I will have my client face me. Okay, sir, ipapalpate ko lang po yung or i-check ko lang po yung symmetry ng sternocleidomastoid muscle, no? Forward po tayo, sir. Okay, sir. Thank you po. So, the sternocleidomastoid muscle and the trapezius muscle is both symmetrical or in symmetry. And then, I will have my client to touch the chin to the chest, to each side, and to each shoulder. And I will assess for any limitation of motion. And then I will also note for presence of stoma or tracheostomy. Okay, sir. Touch nyo lang po yung chin ninyo sa chest ninyo. Sa chest po. Ganito po. Okay. And then, to each side naman po. Move nyo po yung neck ninyo. Okay. And then, ayan. Sa isang side. And then, side to side po ulit. Touch nyo po yung shoulder nyo, sir. Kabila po. And upward po. Okay. Thank you, sir. So, there are no limitations of motion. Thus, the client has full range of motion in the head and into the neck. And then, there is no also presence of stoma or tracheostomy. Now, I will palpate my client's neck. So, I will stand in front of my client. And then, I will, with the use of my finger pads, I will palpate the sternocleidomastoid muscle and note for any presence of masses and tenderness. Okay, sir. Pakisabi lang po kapag may masakit po sa pinalpate ko. Okay pa?
Opo.
So, there are no masses on the sternocleidomastoid muscle, and there are no tenderness, or there is no tenderness reported by the patient. Now, I will stand behind my client, and then I will, with the use of my finger pads as well, I will palpate the trapezius, and I will note for any presence of masses and tenderness. Okay, sir, just tell me po pag may masakit po, okay? Wala po masakit?
Wala.
Thank you. So, there are no also presence of masses and tenderness recorded by the patient. Now, after inspecting and palpating the neck, I will now inspect the thyroid gland. So, I will secure at a tangential lighting and shine it at an oblique angle on the client's anterior neck. And then I will have my client look straight ahead and with the head slightly extended, and then I will have my client drink a sip of water and swallow twice. And as the client swallows, I will observe the front of the neck, and then I will observe the area of the thyroid and the isthmus to determine presence of masses and symmetry of movement. Okay, sir. Slight looks lang po, straight ahead lang po. And then, slight extend ko yung head. And then, drink po kayo ng sip of water and swallow twice po. Wait lang po, sir. Okay po. Okay, sir. Thank you po. So, there are no presence of mass. And, sir, meron po bang masakit nung lumunok kayo?
Wala.
There is no tenderness as well reported by the client on the area of the thyroid and isthmus. Now, we will proceed to the palpation of the thyroid. So, there are two approaches when palpating the thyroid. First is the posterior approach, which I will demonstrate. So, first, I will have the client sit comfortably or comfortable po in your position. Okay, sir. Thank you. And then, I will stand behind my client. And I will ask my client to lower the chin to the chest slightly to relax the neck muscles. So, lower nyo po yung chin ninyo slight sa chest. Okay, sir. Para ma-relax po yung muscle. And then, after that, I will place my thumb on the back of the client's neck, and I will bring the other fingers around the neck anteriorly with the fingertips resting at the lower portion of the neck over the trachea. And then I will move my finger pads over the trachea rings. Now I will instruct my client to swallow, and I will palpate the isthmus for presence of nodules and enlargement. Okay, sir. Swallow po kayo. Okay. So, the isthmus has no presence of any masses, and there is no enlargement as well. Now, I will have my client incline the head slightly forward. So, forward niyo po yung head niyo. Slightly lang po, sir. Okay. And then I will place my fingers on the left hand against the left side of the thyroid cartilage to stabilize it, while placing the fingers of my right hand gently against the right side. Panghawak ko ito, sir. And then, I will palpate the surface of the glands for nodularity, consistency, and tenderness. Masakit po ba, sir?
Hindi po.
Okay. And then, I will instruct my client to swallow a sip of water, and I will palpate the surface of the gland again. So, sir, swallow po kayo ng sip of water. Okay, sir. Meron po bang tenderness habang lumulunok?
Wala.
Okay. So, there are no tenderness reported by the patient, and there is no masses as well. There is no nodules as well, and the movement is consistent and smooth. Now, I will do it or repeat the procedure on the other part. Okay. Masakit po ba, sir?
Hindi.
Okay. Drink po kayo ng water. Okay, sir. Masakit po ba?
Hindi po.
Okay. So there is no tenderness as well on the other side, and there are no masses, there are no enlargement, there are no swelling, and there is no nodularity, and the movement is smooth and consistent. Now, I will do the anterior approach on palpating the thyroid. So first, I will stand in front of my client, and I will ask my client to flex the head slightly forward. So, paki-forward lang po ang head. Okay. And then after that, I will place my right thumb over the thyroid cartilage or on the thyroid cartilage, and I will displace the cartilage to the client's right. Sabihin nyo lang po pag may discomfort na nararamdaman. And then, I will grasp the elevated and displaced right thyroid lobe with my thumb, index, and middle finger on the left hand. And I will palpate the surface of the gland. And note for nodularity, consistency, and tenderness. Okay, sir, may masakit po ba?
Wala.
Okay, sir, try nyo naman po mag-swallow. Okay, may masakit po ba?
Wala.
So, I just instructed my client to swallow, and I palpated the surface of the gland again. And then I will repeat it on the other side. Okay. May masakit po ba, sir?
Wala.
Swallow po kayo.
Wala.
So, there is no nodularity, and there are no masses. There are no tenderness as well as reported by the client, and the movement when swallowing is consistent. Now, I will auscultate the thyroid. So, I will have my client sit in a comfortable position, and then I will stand in front of my client. And then I will place the bulb of my stethoscope onto the right, over the right thyroid lobe, and I will auscultate for any roots, and I will repeat the procedure again to the left thyroid lobe. Okay, sir, pakipigilan na po yung breath ninyo. Saglit. Okay, sir, hinga po kayo. And to the other side, pigil po ulit ang hinga. Okay, sir, thank you. So, both thyroid lobes have no roots as auscultated, and the sounds are clear. Now, I will inspect the lymph nodes. So, I will stand in front of my client again, and then I will expose the areas of the head and the neck to be assessed. And then I will inspect the nodal areas of the head and the neck for any enlargement, swelling, or inflammation. So, there are no swelling and the inflammation and enlargement of the nodal areas on the head and the neck. And then now I will palpate the lymph nodes. So, I will have my client sit in a comfortable position, and I will stand in front of my client. And then, after that, I will face the client, and then I will conduct an assessment on both sides of the neck simultaneously. So I will have my finger pads and tips. I will move them in small circles of palpations using a gentle pressure, and we will be having or following a rotational sequence or a I will be following a systematic sequence of the palpation. So I will begin over the pre-auricular. So I will use the fingertips of my middle three fingers in palpating. I will begin at pre-auricular. So sabihin niyo lang po siya pag may masakit sa pinapalpate ko, okay? Then to the post-auricular. To the orbital. Submental. Diretso lang po. Lugyan niyo po ng force. To the submandibular and to tonsillar. Then moving down to the neck, I will evaluate the anterior cervical chain. And then the posterior cervical chain. And the supraclavicular nodes. The infraclavicular nodes. So in palpation of the lymph nodes, I will assess or I will note for the size, the shape, the elimination, mobility, consistency, and tenderness. So sir, meron po bang masakit sa mga pinalpate ko po?
No.
Okay, so the size of the lymph nodes I palpated is relatively small, so it is not enlarged. There are no swelling, there are no inflammation, and there are no hardness as well on the lymph nodes. And that's all for my physical assessment. I am done, and now I will assist my client to comfortable position. Comfortable po ba kayo, sir?
Okay.
Okay, sir. Thank you po. And then I will perform hand hygiene and observe other infection control procedure. And I will document the findings on the client records. So that's all for my assessment of the neck, the head, and the regional lymphatics. Thank you.